Montelukast, brand name Singulair, is a medicine that is commonly prescribed for asthma and allergies. The FDA and the MHRA issued warnings for Montelukast after there were multiple reports and studies that showed symptoms including aggression, agitation, and suicidal thoughts. So in this video, I will explain everything you need to know about Montelukast, especially what it does to the body and about all its potential side effects. I'm also going to discuss the risks and the latest drug safety alert. I will also answer the most commonly asked question in my clinic about Montelukast at the end of the video. I truly believe you should be fully informed about taking any medication, so let's get started without further ado. What is Montelukast? It's used to prevent the symptoms of asthma. It's usually prescribed when asthma is mild, and it can stop it from getting worse. It can also help people with asthma who have breathing difficulties when they exercise, and with seasonal allergies such as sneezing, itchiness, and a blocked or runny nose. Montelukast is sometimes given to people without asthma to treat hives that last for more than 6 weeks. So how does it work? Montelukast is from a group of medicines called leukotriene receptor antagonists. Montelukast works by stopping the chemicals called leukotrienes in your body that usually narrow your airways. Leukotrienes are released in your body when you have an allergic reaction to something like dust or pollen and when you exercise. So Montelukast helps to reduce the level of leukotrienes, which results in stopping you getting symptoms by helping prevent your airways from narrowing caused by inflammation. So this makes breathing easier and prevents asthma attacks. So most adults and children aged 6 months old and over can take Montelukast, but for the purposes of this video, I will be focusing on Montelukast for adults. So who may not be able to take it? It's not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to Montelukast or any other medicine. If you have a rare hereditary problem of galactose intolerance. So how and when do you take it? Montelukast comes as 10 mg non-chewable tablets, chewable tablets in strengths of 5 mg or 4 mg, and granules in sachets of 4 mg. The usual dose for adults is one 10 mg tablet once a day, taken with or without food, and swallow the tablets whole with water. Most people take Montelukast once a day in the evening to prevent symptoms of asthma or allergies. If exercise makes your asthma worse, your doctor might tell you to take Montelukast 2 hours before you exercise, and never take more than 1 dose a day. It starts to work immediately and takes about a day to start to help asthma symptoms. If Montelukast has had no effect after you've been taking it for 4 to 8 weeks, see your doctor to talk about other treatment options. So what are the common side effects? Diarrhea, high temperature, headaches, stomach pain, feeling or being sick, upper respiratory chest infections, a rash, changes in liver enzymes checked with a blood test, unusual tiredness or weakness, body aches or pain. So what are the serious side effects? Now call your doctor if you notice mood changes and you become depressed, aggressive, or you're thinking of harming yourself. If you see things which are not there, called hallucinations. If you're finding it harder than usual to concentrate or remember things. If your speech changes or you start stuttering. If you have shaking or trembling in any part of your body. If you have an unusual or fast heartbeat. If you develop a combination of symptoms such as flu-like illness, pins and needles, or numbness of arms or legs, worsening of asthma symptoms or a rash. Or if the whites of your eyes turn yellow or your skin turns yellow, as this can be a sign of liver problems. There is also a possibility of having a serious allergic reaction to Montelukast. Now, these are not all the side effects of Montelukast. For a full list, see the leaflet inside your medicines packet. So now let's address the question of what are the risks of taking Montelukast. In early 2020, the US medicines watchdog, the FDA, responded to decades of escalating concerns about Montelukast and then added a warning on the drug's label that it could cause aggression, agitation, and even suicidal thoughts. This was based on a 2015 study saying it showed significant penetration of the blood-brain barrier in rats. The FDA concluded that Montelukast could act directly on cells in the brain. Now, the UK medicines watchdog, the MHRA, released a drug safety update for healthcare professionals in 2019, and then another reminder drug alert in 2024 for the risk of neuropsychiatric reactions in all patients, including adults, adolescents, and children. Reports included new or worsening changes in behavior, mood, and sleep, such as nightmares, hallucinations, aggression, agitation, anxiety, depression, disturbances of attention or memory or thoughts about self-injury while using Montelukast. You should seek immediate medical attention if you or your child experiences these symptoms. It is also very important to tell your friends and family that you are taking Montelukast and that this medicine is associated with side effects that affect mental health, because you may not notice some changes in your mood, sleep, and behavior, but other people may notice changes or new symptoms that you will need to talk to your healthcare provider about. And lastly, the most commonly asked question in my clinic is what's the difference between Montelukast and Cetirizine? Cetirizine is an antihistamine that treats seasonal allergic rhinitis, also called hay fever, or skin reactions caused by insect bites. It may cause drowsiness and other side effects that I discuss in another video that I will leave a link for down below. Now, Montelukast is taken daily for the maintenance treatment of asthma in conjunction with other inhaler therapy, or it can be used for seasonal allergic rhinitis. It will not relieve an acute asthma attack, and some people may experience unwanted neuropsychiatric effects as discussed in this video. And I will leave a link down below if you would like to learn more about the Ventolin inhaler that is used in an acute asthma attack. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos, and please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos and playlist.